I'm a pediatrician. For years, I worked at a clinic in San Francisco where I saw a lot of kids with familiar problems: asthma, diabetes, and frequent ear infections. But one day, a pattern started to emerge that I couldn't ignore. I had a young patient who had developed recurrent, severe ear infections. Antibiotics weren't working. After exhausting the usual medical options, I started to ask different questions. It turned out her father was an alcoholic and her mother suffered from severe depression. Her home was a constant place of chaos and fear. I realized her physical symptoms weren't just about germs. They were about stress. I had to ask, what if this isn't a psychological problem? What if this is a biological problem? What if childhood trauma is not a mental health issue, but a public health issue? My questions led me to the Adverse Childhood Experiences, or ACE study. This study looked at 10 categories of childhood trauma, things like physical abuse, emotional neglect, or growing up with a parent who was incarcerated or mentally ill. What they found was stunning: a direct, powerful, graded dose relationship between the number of ACEs a person had and their health outcomes decades later. If you had an AC score of 4 or more, you were twice as likely to have heart disease. You were significantly more likely to develop stroke, cancer, and diabetes. The study showed that trauma is a major risk factor for 7 out of the 10 leading causes of death in the United States. The science explains the link. When you're exposed to stress, especially when you're a developing child, you activate your fight or flight response. Your heart races, your blood pressure goes up, your stress hormones spike. In a safe environment, that response shuts off. But for a child living in chronic chaos, that stress response is constantly on. We call this toxic stress. Toxic stress literally changes your brain structure. It damages the immune system. It alters your hormonal systems. It makes you biologically predisposed to disease. The child isn't failing to cope. Their biology is adapting to chronic stress. Once we understand the science, we know that the solution isn't just treating the disease. We have to treat the root cause. We need to screen for trauma and treat the toxic stress response. It means shifting our mindset in every clinic, in every school, in every community. We need to stop asking what's wrong with you and start asking what happened to you. When we embrace this truth that childhood trauma has a lifelong physical effect, we can begin to heal not only children, but entire communities. The health and well-being of the next generation depends on it.